Welcome to Bostic Health, where we challenge the business of healthcare and explore bold ideas that drive meaningful change. Each week, we bring you candid conversations with top experts, innovators, and leaders, exploring the latest trends and technologies shaping the future of healthcare. Join us and be part of the conversation in transforming healthcare.
All right, so we're here live at ViVE, another edition of the Bostic Health Podcast. I'm honored and pleasured to be here with Amy Gleason. So Amy, kind of tell us why you're here. I know you have a lot going on. There's a lot going on overall relative to digital health and kind of the whole ecosystem here in the U.S. Why don't we start there?
Yeah, so I love ViVE. It's a great conference. I can see a lot of the innovative startup companies that are really doing things that maybe we don't hear about in the government as much, as well as more established players and kind of learning what they're doing. So I always love to come and get good ideas and find out what's happening in the world.
So obviously so much has happened specifically with AI in the last 3 to 5 years. And the last probably 18 months, we've seen a rapid acceleration, the mass adoption of AI and all of our everyday personal lives. How do you kind of see, let's not look back, but look forward maybe, in a quick timeline, 18 months to 2 years, what do you see happening and being able to be used technically that we haven't been able to do so before?
I think the biggest unlock is really patient empowerment. We've been talking about patient empowerment and giving patients tools for a long time, starting back with the Dr. Google era when, even WebMD. But I think AI is just really leapfrogging all of the ideas we even had about helping patients because it's bringing them useful tools in a way that they haven't had before. And people are engaging at it at a much faster scale than anything I've seen before. I think the biggest challenge to that is you have to have the data underneath that to make the AI useful.
Right.
So right now, a lot of people are using it kind of more like a Dr. Google and they're just asking questions, but the AI doesn't have their experience and their past medical history to be able to tailor that and make it personalized.
Yeah.
So that's one reason we're so focused on interoperability. And then we're also really focused on how do we empower innovation and unlock some of these things for patients to have access to.
And when we talk about data, the integrity of that data is so critical, right? Especially at the speed and scale with which we have adoption. So maybe from your perspective and lens, how do we think about controls or having controls in place around data integrity as we move through this adoption of AI?
Right. So I think the fire standards have done a lot of work on this. I've had a lot of people say, do we even need standards anymore? Can we just have AI just read everything and make it standards? I think probably at some point we'll get to that. But right now, I think even talking to the major labs, they still also believe that that structure really helps the AI get better over time.
Yeah.
So I think we really need to do that. I think we also need to put privacy protections on things. So patients, when they're coming in, like as part of our ecosystem work at CMS, all the major labs that are committed through their pledge to do this work for patients have to agree to put the data in a private area and not train their models on it without explicit permission from the patient and clear language, not in some long scrolling thing, but actually make it really clear the trade-offs of that for the patient.
And how does that actually take place from the patient perspective when they're going through their day-to-day and they're engaging with a provider or a laboratory? What does it actually look like?
I think there's a few different ways. So one, they're just direct-to-patient tools, and I'm sure you've seen the OpenAI launch of their ChatGPT Health, and then Anthropic also released theirs, both for patients and providers. So it's a solution on both sides. So that's one way. Both of those and others have pledged along. Google, Microsoft, Amazon have also pledged to do this, but basically let their patients get their medical record, but only using their identity, not having to log into all the patient portals or remember every doctor you've seen.
Yeah.
So our first pledge is due March 31st, where we'll have a lot of networks ready to support this. For a patient, just can use something like ID Me or Clear, verify they are who they say they are, have things like your past last names and addresses and phone numbers that help match you to the data.
Oh, wow.
And then be able to query and get all your records with a one-touch button instead of how complicated it is today.
Yeah.
So that's just a consumer going and doing that. I have a daughter with a rare disease, and she's really shown me the possible. Have some amazing, like every day, she tells me new stories of how AI has changed something. So I think patients just finding it is one way.
Yeah.
I think also providers are starting to adopt things and push them out, either from an existing, more traditional provider or new solutions, kind of like Doctronic, that are doing things, or UpDoc, where the providers are pushing things out themselves and doing care coordination or actually refilling meds in the doctronic way. So I think there's kind of a variety of ways that they'll touch patients.
And when you think about, you mentioned labs and diagnostics as really kind of a way to advance in a more rapid scale with the adoption of AI included in kind of those tools. What are your thoughts relative to now being able to cultivate the data through diagnostics with AI to being able to use that not only for, sick care, but on the preventative care level?
Right. Patients having these tools anytime, wherever they are, we talk a lot about access, but it's not just about finding a doctor to go see or getting a test. It's a Saturday night at 11 o'clock and you have some question. You should be able to get an answer right then and get direction on whether you should just do something at home or whether you should go to the ER. And, there's various levels of whether it's clinical advice or just some information for you.
Right.
But I think, by empowering people to do that, it can really change the way that we do things. So
Yeah.
I'm really excited about that.
And when you think about the line of delineation between information and clinical advice, right, that's documented or rooted in fundamental, knowledge, where do you see, because there are a lot of blurred lines now, especially with some of the, low acuity triage stuff. So as this continues to evolve, how do you see the integration of physicians and providers and the folks that are giving, that bedside care to be involved in the processes?
Well, first of all, I think it's important that an app or tool is clear about which path they are, if they're informational or whether they actually are qualified to give clinical advice. So I think the FDA is taking some really innovative approaches to partner with industry. So we have the Tempo part of our access model where they're really diving in and saying, let's work on a plan to test this out together because they know we have to move fast in order to do this. And they're really being collaborative. So I'd encourage people to work with the FDA.
Yeah.
I'll give you an example of a story my daughter had that really, I think, touches on some of this. So just using regular ChatGPT, not any kind of, this is before their healthcare product, but she has a rare disease. She was trying to get into a clinical trial. She takes 21 pills a day.
Wow.
I guess 2 infusions a month. This trial could make her not have to take any meds anymore if it works.
Right.
So she goes, she's excited. I said, I'm really sorry you can't do it because you have overlap of ulcerative colitis. Also, it's an exclusion because it would be dangerous to take you off all your meds. So she's 27. She loaded all of her medical history into ChatGPT and said, find me another clinical trial. I'm tired of this. I don't want all these meds. And it said, actually, I don't think you need another trial because I think you're qualified for this one because I don't think you have ulcerative colitis. And it read her biopsies from 15 years ago.
Wow.
And she has microscopic lymphocytic colitis, which wouldn't have changed her treatment for 15 years.
Yeah.
But it makes her eligible for a clinical trial that she's now in the process of enrolling in. And so I think, the power of this kind of stuff, and that's just reading off PDFs. But once we get to, more data going forward, I think it's going to be incredible.
And obviously, it sounds like your daughter's an empowered and educated, right? And kudos to her for kind of staying strong through that process. But we also have folks who are not as fortunate or educated. So what do we think about the tools and technologies for not only folks who are empowered, patients, if you will, but for the general populace, right? Who really can kind of get their hands dirty and use these tools to their advantage?
Well, first of all, not all patients are going to want to do this. And it's important we meet people where they are. Some patients are going to be like my daughter that are like all about it all day long. Some are going to want a caregiver or someone else to do it for them. And others are just going to want their doctor to do it and they're not going to really be engaged. So I think we have to meet them at all those places. But I also think that we see at Medicare, it's an opportunity for us to drive behavior and to help people realize what's possible. So we're building out a Medicare app library that's part of this ecosystem where apps are tested and they have to go through a certification process first to make sure that they're first following privacy policies and telling patients clearly what they do with their data. Also a security check.
Right.
But then we're recommending them to things on like Medicare.gov, maybe saying something like, oh, it looks like you have diabetes. Did you know that there's this app available to you? And driving those things. I also think that we're surprised a lot of times. My 84-year-old dad is now an avid user of AI, but it's because he had my daughter sit with them for a short period. And now it's constantly, he's like, oh, I put my lab results in and I heard this information. Or I was having a question about, he just went off of a med because he had a little heart procedure and he's asking questions. And like, it's making him feel more comfortable with his treatment and more empowered. And he's 84. So I think, we shouldn't assume that some people won't do it. I think we're going to be surprised who does.
Yeah, no, that's excellent. That's a great two examples from your family, kind of real world examples, right? So as we wrap up here, and we have a lot of real world, activities happening relative to businesses that have been in the business a long time and are really trying to make a difference in newcomers. What's excited you about ViVE so far, and where do you think you kind of see some hidden gems that we should be looking out for?
Well, I haven't been here very long yet, so I haven't seen a whole lot here yet. But I think just seeing some of the AI uses, I think we think of just like phone chats and things like that, but the variety of things that are coming out and a lot of consumer focus really gets me excited. So I'm looking forward to seeing more.
Great. Well, I know you have a busy schedule the rest of the day. Thank you so much for your time, and great catching up with you.
Thank you for having me.
Okay, thanks.